Female and male surgeons are evaluated differently. 3 studies that have all been published within the last 24 months that demonstrate that gender plays a significant difference in the evaluation of surgical residents. First study's out of Canada and was published in JAMA Surgery 2020. I underline the key points. I emailed out a survey to all Canadian general surgery residents during the year of 2017-2018 training period. They asked 129 questions, but their main objective was, did you feel like you were treated differently or dismissed during your surgical training because of your minority status or gender? 81.2% of females that completed the survey reported feeling that their medical expertise was dismissed because of their gender at least once annually. 33% of respondents that were female experienced dismissal of their expertise at least once every week. Not surprisingly, 98% of male residents reported never experiencing dismissal of their medical expertise because of their gender. Study number 2, Journal of Graduate Medical Education 2021. This study came out of Harvard. Whereas our last study was basically a survey among residents, this study was quite different. Multi-institutional, so 71 programs. We sent it to both trainees, so residents, and their bosses, the attending surgeons. Looked at 2 key things: resident autonomy, meaning how much of the actual procedure did the resident do, and subjectively, the resident's performance. 94,000 evaluations. Big data, 71 institutions. Whatever did they find? Lower ratings of operative autonomy to female trainees than male trainees, controlling for their training level. While there was no difference at the beginning of their training, the gap increased as the resident became more senior. Here's the kicker. They found no difference in the attending's rating, or basically the grading of the resident's performance when they compared female to male trainees. And ever heard of imposter syndrome? And the sad part of this study, females knew that they had less autonomy and they perceived that they had a worse performance compared to their male counterparts, when actually the study found that females and males had the same performance. About last study is out of New Zealand and looked at ophthalmology residents. Out of all the studies, this was the most objective. It looked retrospectively at the case logs, basically how many procedures and which procedures did the residents perform during their training. 12-year period. Whatever did they find? Surgical volume for female residents was 21% lower than their male counterparts. Again, it was a gap phenomenon. The gap only grew larger as they became more senior. And time off had no bearing on case numbers.